Your baby can also absorb castor oil because castor oil can cross the placental line. So be very careful with this because too much castor oil in mom can lead to diarrhea and GI upset. And if it gets to your baby, it can cause your baby to poop in the womb. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. And if you are a returning viewer, I thank you for sticking in there with me. Make sure you hit the subscribe button. That is the way you join this growing community of active learners who are becoming empowered in their own personal care. Now, in last week's video, I covered a lot of signs that a mom can experience as her body transitions into true labor. So if you haven't watched that already and are interested, make sure you check it out. In today's video, however, I will be covering some things that women can do when they are good and ready to give birth to their baby, and these things should help labor come along if everything works effectively. Now, before I jump into today's video, I want to put this little disclaimer here. Make sure that you are not using the content of this video to diagnose yourself. Instead, it is very important for women to work with healthcare providers who know your health history so that when they create a care plan, it addresses your specific needs. And without further ado, let's jump right in. So right off the bat, one of the first things that moms can try when they want to go into labor is simply going to take a walk. When you begin to walk, a couple of things work in your favor. First thing is gravity. Gravity works best when it is pulling something straight down. So when you get up and you are moving your legs actively, gravity is helping you sort of work that baby down into the birthing position and into the cervix so that that baby's head begins, or whatever the presenting part is, begins to dilate the cervix and get labor going. Walking can also help to lead to irritation of those cervical muscles and the joints in there. And when they become irritated, those muscles can begin to contract. And if those contractions become steady and regular and last a while, that's how labor begins. Right on the heels of walking is squatting and stretching. A lot of women are told don't squat during your pregnancy. That can lead to adverse outcomes, but squatting is perfectly safe during a woman's entire pregnancy, and more so when she begins to near her delivery time, especially if the baby is head down. When you squat, you increase the amount of cervical space that you have, and that helps your baby to come down and become more engaged in the birth canal. So squatting can actually help you bring baby down. And then when you are squatting, gravity is really supporting your action, helping to pull baby down. When your baby comes down sufficiently enough, that helps the delivery process. So that's another thing that moms can do, and that is squatting. Another thing that moms can try to help them go into labor naturally is to get a pedicure or a foot massage. There are certain pressure points along a woman's body, especially her feet, and her feet contain one next to her big toe and another one next to her small toe, that when these pressure points are touched specifically, they greatly increase the likelihood of releasing oxytocin. Oxytocin is the labor hormone that helps contractions come on, dilate the cervix, and gets birth going along. So if you are ready to give birth and you're tired of being pregnant, you can definitely try a foot massage to get labor going along. Another natural way to get your body to begin to have contractions is to try a nipple massage. It is becoming more common knowledge that applying any sort of stimulation to the nipples can cause the release of the hormone oxytocin. Now, as previously mentioned, oxytocin helps a woman's body to contract. A lot of first-time moms learn this the hard way. They think that after giving birth to their baby, that contractions go away. But then when they try to breastfeed, because of that nipple stimulation, they start to get fresh contractions on board. So if you are still pregnant and you are almost due and you're ready to give birth to your baby, go ahead and use nipple stimulation. Now, nipple stimulation has a little bit of a caveat, or you got to be careful here. Excessive nipple stimulation can cause contractions that are extremely hard and painful and last really long. Also, once you stop stimulating the nipple, there's a chance that the contractions will go away. So if you're going to do nipple stimulations, make sure that you are in a safe area where you can be seen if those contractions come on really hard. And then also make sure that you are not overstimulating yourself or turn yourself into the horn of a vehicle, just pressing. Make sure you do it very carefully. Make sure you stop every 5 minutes so that your body can rest from the contractions that are stimulated and give itself the opportunity to catch its breath and then try it again. Whatever happens, make sure that you are not doing it for so long that your body gets overstimulated, because then that can also be counteractive to getting contractions and starting labor. Another natural way to go into labor is to do exactly what it took to get the baby there in the first place. Semen contains some prostaglandins that can help to stimulate the cervix, soften it up, and get labor going. So if you are tired of being pregnant and you want to go ahead and start contractions and get your body working towards giving birth, then you definitely can try sexual intimacy. It's not always guaranteed, but there have been a lot of women come out and say, hey, we did this and baby came out. I've also had in my personal practice situations where we have admitted women and had to stop their labor because they engaged in sexual activity. So if you are ready to give birth, having sex and, being physically intimate is another way to get things going naturally. Now, if you are really brave or just really tired of being pregnant, you can certainly try acupressure or acupuncture. Acupressure requires the application of pressure at certain points along the body, and acupuncture requires the use of specialized needles to sort of change the energy movement within a mother's body. Now, keep in mind that just like with foot massages, these things need to be done by somebody who is highly specialized and an expert, not just someone who's just going to go and put needles all over the place and make you end up looking like a doll that nobody likes. So you can use acupuncture or acupressure to start labor naturally. The next 3 natural ways to get labor started are based on something that a woman needs to eat. Keep in mind, though, that the findings are very anecdotal in nature, and an anecdotal means that it's based on personal report. The first one is the eating of dates. Now, a date is a natural fruit that when consumed can help to ripen a woman's cervix. They do not necessarily cause contractions in a woman's body, but when your cervix is nice and soft and ripe, when you do start having contractions, your body responds better to it. It has also been shown that women who eat dates before or as they get towards the end of their pregnancy have a lesser chance of needing oxytocin, which is the medication that is used to get contractions going naturally within a woman's body. The next thing is to eat pineapples. Now, pineapples contain a substance known as bromelain. When bromelain is applied to the uterus of rats, it causes the uterus to contract. But human beings are not rats, nor will pineapples be applied directly to your uterus. You have to eat it first. It has to interact with your stomach acid, go through your GI tract, and then be absorbed in your body. When you eat too much pineapples, what you get in your body is not true contractions. Rather, what you are dealing with is an upset stomach, and your GI is dealing with cramps and irritability. That excessive irritability is frequently translated or interpreted as real labor contractions, but it is not. Keep in mind that if you eat too much pineapples, that it can cause your body to begin to experience diarrhea. You do not want diarrhea in exchange for contractions. So make sure that you eat your pineapples in moderation. And then, to be quite honest with you, I don't think that pineapples eaten in moderation will even lead to contractions. So like I said, everything taken with a pinch of salt. Take pineapples in moderation, and when your body is ready to have those contractions, it will start it naturally. Now, the last food item that a lot of women swear by to start labor is castor oil. Castor oil, just like pineapples, when taken in large quantities, can lead to GI very upset. And when your GI is upset, your body is going to think that it is having natural contractions, where truly what's happening is that your stomach is cramping from a high level of oil being in your system. Your baby can also absorb castor oil because castor oil can cross the placental line. So be very careful with this, because too much castor oil in mom can lead to diarrhea and GI upset. And if it gets to your baby, it can cause your baby to poop in the womb. And when your baby poops in the womb, there is a higher chance that your baby can inhale it. So be very careful if you choose to use castor oil, and make sure you use it under the guidelines of a trained professional, if your professional will even suggest it in the first place, or don't use it at all. Let nature do its natural thing. Ladies, believe me, first time pregnancies, typical length of it is 41.5 weeks. That's 41 weeks and 3+ days. Allow your body to get the hang of doing things naturally. If your labor does not start within a normal frame of time and your doctor has been watching you and think that it's time to get things going, then another thing that can be done is that a woman's membranes can be stripped. Membrane stripping is not fun. They go in there and they rub the inside of a woman's cervix to try to irritate it enough to get contractions going. If it succeeds, those contractions can really give you a run for your money. They will hurt. In the same light, there have been women who have had their membranes stripped, and yes, they get a little bit of irritation, but after a while, because their body is not ready for contractions yet or to give birth, then all those contractions go away and you deal with just the knowledge that your membranes got stripped, and that really hurt. So give your body some time to do what it knows to do naturally. And if all else fails, your doctor can certainly use medications to ripen your cervix, and then there are other medications that help get contractions going naturally. I wish you success as you start to near the end of your pregnancy and transition into giving birth. And I hope that you have a smooth, easy delivery and a swift recovery. If you have learned something from the content of this video, do not forget to give it a huge thumbs up. Share this video with somebody who you believe can learn something from it, and join this growing community of active learners who are participating in their own health care. And until the next time, be blessed.